We're all excited about the new version, but in order to explain what it is, I need to start from the very beginning, why we created TrialHub in the first place. 2 years ago, when we started, we found out that clinical trial strategists are really challenged with lots of issues. They just didn't have one place with trustworthy data. And we saw the old systems, they were forcing these experts to spend hours and even days in verifying this data in manual calculations. And this was causing also inaccurate trial planning and budgets. 2 years later, TrialHub is now automating all of these tasks and is providing these experts and feasibility experts, mainly in clinical operations, with the most reliable data set. But now, with the new version, we're going to the next step. We are leading a new generation feasibility, clinical trial planning as a whole. We are combining not just the traditional feasibility like country and site selection, but we are also bringing this patient feasibility, which is usually overlooked. We know that by understanding the patient experience, people will be able to better align their clinical trials. And thanks to generative AI, NLP, all the latest technologies, we were able to combine tens of thousands of data sources and our expertise, leading the industry into better understanding of both sites and patients. Patient recruitment is exactly why we started patient feasibility, because we knew that we need to prevent challenges with patient recruitment and not fix them. As a matter of fact, a few years ago, some of the forward-thinking pharma companies started doing an experiment with trial simulation with patients in order to assess the patient feasibility of their future trials. It turned out that way they decreased the timelines for patient recruitment with up to 40%. You know what this means for the budget. So patient feasibility has a big promise to improve patient recruitment and retention. And I want to encourage every single patient recruitment expert, not just the experts, but the entire industry. We need to utilize our patient recruitment experts and resources in a better way. Instead of really using these resources for rescue strategies, to actually think how can we prevent these challenges, and understanding the patient can really help us to achieve that. We've been always developing the product, TrialHub, together with our clients, and the feedback has driving us forward. Today is the same, and I'm super excited because of one particular thing. When we first announced the new version, we wanted to create a smooth onboarding process. We started first with the team leaders, and we really gave them the responsibility of deciding when the other team members should go and start working with the new version. And we thought that this will take some time, but when the leaders saw the new version, they said, no, we need it immediately. Please make sure that the entire team has that, because we need that as soon as possible. And that's a great signal that we've really achieved a great progress. But what excites me even further is that these people are ready to work with us to further develop, further dream what else we can achieve to make clinical trials more aligned with patients, with sites, and the entire ecosystem.